Hi, my name is Dr. Brett Richens with Aspen Heights Dental, and I wanted to talk a little bit today about root canals. This is something a lot of patients are pretty familiar with. Many patients have had a root canal before. Some patients have had problems with root canals in the past, or they've heard about someone having a root canal and a terrible experience they may have had with that. Typically with our patients, these aren't the experiences we have, and so I wanted to maybe dispel some myths and talk a little bit about what a root canal is, why we would need a root canal, and what your options are in this situation. A root canal would be required typically if you have extensive decay in your tooth that's getting close to the nerve or the pulp of the tooth, if you've had trauma to the tooth that can cause these problems, a broken tooth, or even just hitting the tooth hard enough that it kills that tooth, or sometimes complications of extensive dentistry. If we had a really deep cavity and we had to have a filling or a crown put on that, sometimes as a complication following that, a root canal can be required. And so it's important for patients to understand that root canal is a time-tested and proven dental treatment. The American Academy of Endodontists says that about 30 million root canals are done each year. And so they're done with good success. But it's important that the cases are chosen appropriately and that we understand why we're doing this. What a root canal does is it removes the blood supply and nerve to the inside of the tooth, and that will take away any cold sensitivity, extreme cold sensitivity you're having, or if we have infection in that tooth, get rid of the source of that infection, then allowing your body to heal and recover the tissues outside of the tooth. We still have blood flow and supply nourishment to the exterior of the tooth through ligaments and bone on the outside of the tooth. So patients can come get root canals, something that allows us to save your natural tooth, which is always ideal if it's possible, and allows a patient to get out of pain, get rid of that discomfort that they have when chewing, and be able to enjoy eating foods again and do that without having pain. It's also important to note that when looking at a root canal and deciding what to do, we have technology that allows us to look three-dimensionally at that tooth, to look at the canals. A lot of patients have heard of missed canals during a root canal. This allows us to look at those, understand what the internal anatomy of that tooth is before we ever start the procedure, and decide if it's something that should be done here by our dentists at Aspen Heights Dental, myself or Dr. Dorney, or if it's something that we should work closely with an endodontist with. And there are many great endodontists that specialize in root canals and can help with more complicated cases.